Welcome back. Those were the benefits of consuming h1n1 squash that we brought to you on our iMed segment. We're going to go into a very important topic with a guest that is going to talk about how you need to overcome this and what would be the symptoms going through. Because we all know that dengue and influenza is a much talked about topic nowadays in Sri Lanka because it's been contracted all around the country. So to talk more on this, we have with us Dr Priyankara Jayawardana, who is the consultant physician of the National Hospital. Very good morning to you.
Good morning.
Good morning to you.
Doctor, starting things off, influenza is something that we are hearing very often now. Just tell us what exactly influenza is all about.
Influenza is a viral infection. It has been there in this country for many years and it's seasonal. Every year, between February to July and June to July and December to February, it comes. And 4 years ago we had a bad attacks, and this time it's more common than last year, and it's most of the time it's self-limiting. Nothing happened. It's just a viral flu, what we call more like common cold, and people recover without any problems. And very rarely people can end up with a pneumonia-like picture, so that would be the bad outcome. But most of the time it's self-limiting and we don't have to panic about it.
Right, doctor, and especially these days it is spreading at a very vast rate, and when we speak of that, would like to ask you, is it because of the climate change that we are experiencing in the country, and is this airborne or there are other sides to it as well?
Yeah, this is the season for this influenza infection. Maybe the chilly weather, change in the climates, maybe the festival gathering, and those things could be the reasons. But every year it's like that. We expect kind of a more number of patients in this year. It is something expected according to the health authorities.
So, doctor, like say normally you get these various types of flu. I can remember, like say, or maybe 2-3 years or even more, there was something like chikungunya or something came in. So influenza. Does this keep on, like say, you mentioned about periods that these come in. So does this go on every year, or is it something that comes in new to our country?
No, it's there. It comes every year. Influenza is a viral infection, and there are two main subtypes, influenza A and influenza B. And influenza A is the commonest type. 80% of the time it's in influenza A, and 20% of the people are influenza B. When it comes to the influenza A, there are many subtypes, but the common ones are h1n1 and h2n3. Last few years we had more h1n1 than h2n3, but nowadays we get more h2n3 patients than h1n1. So people talk about the h1n1. It is a subtype of influenza virus, and it's a subtype of influenza A virus, and this time we get more h2n3 patients than h1n1 patients. And the symptoms and the treatment, there is no difference.
All right. Okay, doctor. So adding to it, if I would ask you now, especially when we take a look at this influenza, like you said, probably it can go to a situation worsening the condition to get pneumonia. If it is for a patient who has got pneumonia earlier and is going through influenza again, what is the risk here?
Yeah. As I told you, the influenza is usually mild infection, but we have identified some high-risk categories. The children less than 2 years, adults, elderly people, people who are more than 65 years, pregnant mothers belongs to the high risk category, and the people who had previous medical problems, especially the people who had pneumonia in the past, asthmatics, and things like bronchiectasis, and chronic kidney problems, and heart problems, diabetics. And next category is the people who are compromised their immunity, like HIV patients, and the people who had organ transplants, and there are some people who are on immunosuppressants like steroids, they belong to the high risk category. Yes, a person who had pneumonia belongs to the high risk category.
Doctor, you mentioned about the early symptoms like slight fever, coughs and cold. So normally if you get a cough and a cold or a slight fever, first thing the people would do is commonly go to the common medicine. But do they need to immediately consult a physician or a doctor on how many days of a flu and cough and cold?
Honestly not. This is, I told you, this is very common and it's everywhere. And if you get fever, high fever, with body aches, cough and cold, and sore throat, and running nose, and throat discomfort, it is, unless proven otherwise, it is influenza. But the other thing, the dengue, is again common in this country. Dengue usually get high fever, joint pains, body aches. Usually they don't get cough, cold, running nose, and sneezing and chest symptoms. Only thing, asthmatics, a person who has asthma or lung problem, if they get dengue, then they could get this kind of a wheezing-like episode. But if I say that a person without asthma get cough and cold and running nose, sore throat, this is influenza. We don't have to panic about it, but we need stay at home, take adequate amount of fluids, paracetamol, and to prevent it going to the next person. So, you have to use a proper face mask and need to wash their hands with soap and water. If they go to a doctor, they don't have to get antibiotics. This is a big problem in this country. Somebody gets cough and cold, immediately they go to a doctor and get antibiotics and antibiotics and antibiotics. And now we are getting resistant to antibiotics these days, so it's not necessary, it's a viral infection. Antibiotics do harm, they are not good to the patient. So some paracetamol, maybe medication to put to the nose, just to reduce the nasal secretion is benefited in two ways. Patient is comfortable when the nose is not blocked and the secretions are less. Other thing, these secretions spread the infection from one person to the next person. So it's better to have some kind of a nasal drop. And medication like chlorpheniramine, previously commonly known as Piriton, those medications, similar medications, reduce the amount of secretions in the person, so it will give a comfort to the patient. And when the secretions are less, it prevents the spread to the next person. And maybe who have a person with cough, they are benefited with the inhaler. You know that people use with asthma, and when you get an inhaler for this kind of illness, you are not going to use it for your lifetime. It's only for a short period, maybe 1 or 2 weeks, to reduce the cough and cold. Antibiotic, honestly, not necessary. They have to use a face mask to prevent it spread to the next person, because the spreading is it's a droplet to the air. When a person coughs, the droplets go and land with the next person. Usual distance is 2 meters. So if you cough and if there's another person in next 2 meters, it can go and land in the next person's face. Mm-hmm. The other thing, when they cough or when they touch their nose and mouth and contaminate with the secretions in your hand, and when they touch the table or bathroom keys or whatever, and next person go and touch the same surface, and when he touch his nose or mouth, it can go to the second person. So if you touch your nose or mouth, wash their hands with soap and water. And when there's a person at home with the cough and cold, better to keep the person isolated as much as possible. And definitely you have to feed the person, you have to nurse the person, and the sick person. The people at home usually they have to wear a mask to prevent it getting to their nose, and they should, whenever they touch the sick person or his clothes or his maybe cup of tea or plate, they have to wash their hands. By doing that, you can prevent the infection going to the next person. We get lots of patients to the hospital with these symptoms. Usually the hospital staff, we don't get that, and we see lots of patients as a doctor with influenza infection, maybe hundreds and thousands. But fortunately we don't get those things because we use special precautions like washing our hands with soap and water. So equally, when home people do that, they could prevent it getting from one person to the next person. Yeah.
And also, doctor, if we speak of this particular disease now, influenza, if a person can get it and then it goes to a terrible state of going into a pneumonia level and weakening of lungs and things like that. So how do you advise for a patient like this probably to immediately get hospitalized, or how should it really happen in terms of medications and treatment?
Well, it's like this. When in simple influenza, usually it's a cough and cold and running nose and body aches and joint pains and fever. It could affect the lungs. Then people get difficulty in breathing and they grasp for breathing. So then it's safer to go to a doctor and probably go to a nearest hospital, because they may need special medication. And the other thing, if we feel the person with influenza is confused, muddled, and not in proper sense, and difficult in breathing, definitely he's a candidate to go to the hospital. In the hospital, we have a special type of antiviral, like antibiotic. The people give antibiotic for bacteria, and that's a special medication to give those people, and people who belong to the high risk. That is usually given when they come to the hospital. It's not available in the pharmacy due to a special reason, because we experience that this oseltamivir, this is the special antiviral, when it was available over the counter in countries like Hong Kong and Singapore and many other countries, and people overused it and developed resistance to that viral. So people who need it, really need it, like sick people, elderly people, people who had kidney transplant and pregnant mothers, when the medication is not given, it was not effective. So in our country, we want to prevent that resistance. That's why it's not available in the pharmacy for ordinary person to go and buy it from the pharmacy. But it's available for the needy people, adequate stocks in the government hospitals and the private hospitals, and adequate stocks are there. So if they come to the hospital as an inpatient, we give this medication, so we don't have to have an unnecessary fear about it.
Right.
Doctor, like say, it differs from individual to individual on the immune system that they can fight this flu. So you did mention that paracetamol or Piriton and taken care of for the person at home. But then what is the position where a person is needed to be taken into hospital? For how many days does the fever need to prolong if you really need to take this person to?
It's the fever usually 4 to 5 days, sometimes 1 week. Children can go usually 1 week. If the fever is going more than 4 days, I think it's a good idea to see a doctor. And in our country, whenever you see a doctor, you have to tell the doctor that I don't want antibiotic, I came for advice whether it's really, really needed. And definitely if the person is having features like difficulty in breathing and confused and sleepy, then should go to a doctor. The last year, our experiences, the young people, they died with influenza. What happened, they ignored it. And they went to work and they did other jobs with viral infection. And naturally the immunity came down and virus was more active, and they had bad pneumonias, and some people, we couldn't save their lives. So if you get the infection, stay at home. Though it is a mild infection, it's a viral infection. If people overexert it, it could be a worse outcome. Otherwise, it should be a simple viral infection and we don't have to panic about it. Our experience is people go to the lab and get the influenza test done. As soon as it's positive, they rush to the hospital and request hospital admission, which is not necessary and which is not essential. But always it's better to keep contact with the doctor, maybe a family doctor or outpatient OPD hospital, and let the doctor to decide whether the patient needs admission to the hospital.
And also, doctor, when we speak of patients who are going through an asthmatic condition, what would be the advice that you would give them? Probably they might suffer more when it comes to an influenza situation like we were speaking of. Yeah.
Asthmatic, I think if they get the infection, it's a good idea to see a doctor early. Mm-hmm. And if it is kind of a bad asthmatics, then I think they need oseltamivir, the antiviral treatment, as an inpatient. And safer to come to the hospital as inpatient, because then we could hydrate them very well and we could keep eye on them and we can give this antiviral medication. And they may need nebulization, that the medication to comfort their lungs, because simple inhaler may not be adequate for them. So asthmatics, I advise them to come to the hospital and get admitted to the hospital. And hospitals, we may keep different places for them because to prevent cross infections. So please don't get upset about it, because it's the safety of the other people. And when everybody is in the same place, it's easy for us to treat them together. The other thing, when asthmatics, when they go to a private medical attention, to use this nebulization, we realize certain small places, they use the same face mask for everybody and request an individual face mask for kind of an individual patient. Otherwise, he may get another infection from another person. Apart from this influenza, there are bacterial infections as well. So, pneumonia patient going to a place and nebulize with the common mask used by another person could end up with a bacterial infection, which is not very good. And the influenza can lead to a secondary bacterial infection, which we keep eye on. And if necessary, when we suspect there's a bacterial infection, then we give antibiotic as well.
Doctor, obviously our country is full of myths, and especially when you are contracted with such fever, there are people who would say, don't eat this, don't eat that, you need to. What is your advice on the food that you need to consume during this period?
It's very individual thing, especially when it comes to asthmatics. They feel that certain foods are not good for them. When they consume those things, their symptoms are getting worse. So if a person feels that this food is not good for me, it's a very individual decision and it's better to avoid it. Otherwise, try to avoid the cold things, cold drinks and cold food, and go for the warm fluids, warm water and warm food. And that's all. And need nutrition, adequate nutrition and plenty of water.
Mm-hmm. And doctor, if I may ask you now, for a patient or rather anybody to identify whether this is influenza or it can go to an extent of probably it might be dengue that the person is contacted with, and how can this problem be resolved?
It's two ways. One thing is, as I told you, running nose, cough and cold, sore throat and wheezing is usually influenza with high fever and joint pains, because high fever and body aches and joint pains are common to all the viral infections. Influenza is a viral infection. Dengue, again a viral infection. Dengue, you get severe body aches, joint pains, headaches, those things, but usually not running nose, sore throat and cough, unless the person is non-asthmatic. So that we can differentiate people on those grounds. Second thing is, there's a test called for the dengue antigen for dengue, and we can check the influenza antigen for influenza. The important thing is, when it is positive For example, if the dengue is positive or influenza is positive in the lab test, it's influenza or dengue. But if it is negative, still it could be the same diagnosis. A person who is having body aches, joint pains, and coming with to the hospital, and dengue antigen is negative. That doesn't mean he doesn't have dengue. Still it could be dengue. These days we get lots of patients, when they come to the hospital, when we check for dengue antigen, it's negative, but subsequently the blood reports, the platelet count comes down, and it ends up as a dengue infection. Influenza is the same. The detecting the virus from the blood test, it's not throat swab, it's not 100%. It varies from 60 to 80%. So if the influenza is positive in the lab test, yes, it's influenza. If it is negative, yes, still it could be influenza. So we don't encourage people to do those blood tests, and those lab investigations, not essential. It's only a complementary thing for the doctor and the patient. And if those tests are negative, you can't say that it is not dengue or not influenza. That's a danger what we experience these days. These blood tests or throat swabs or nasal tests come in as dengue negative or influenza negative, then people think, no, I am safe, which is not.
Dr. Like, so you did mention at the beginning that the influenza comes in various periods, like February to June, to December to February. Like, say, is there any vaccine or thing being now manufactured so that this can be thought about? Like, say, you can really have this vaccine within you and then you are free of influenza?
Yes, there is a vaccine. This vaccine is produced every year. So what they do, the countries, even our country, we have 19 hospitals to collect the samples, and we assess those things at the MRI, Medical Research Institute, to detect what's the type going on these days. And we send this data and relevant samples to WHO labs, and we send it to our regional labs in Australia. And then they decide the pattern, and they prepare the vaccine for next year. And this vaccine is, it's a intramuscular vaccine, and we have to get it every year. And it is not in the hospital freely available. You have to buy it. It costs around 1,500 rupees. Even though it's not available freely, and we get very limited stocks. And no side effects. There are very rare neurological side effects, but this vaccine, commonly known as flu vaccine, especially in the people who are in the northern hemisphere and southern hemisphere, people who experience winter, usually they get this flu vaccine. It's a very safe vaccine, though there are literature says rare side effects. And I don't think we have to give that vaccine to everybody in this country. But people who are at risk, maybe elderly people, people who had pneumonias, chronic lung problems, kidney transplant patients, and this high-risk group, pregnant ones, maybe get the benefit of this vaccine. And but we have to give it every year. It's available.
All right, Doctor, thank you very much for those important points that you brought about on the influenza flu that is going around. Once again, thanking you and hoping that Sri Lanka will be quite free of this influenza in the years to come.
Yeah.
Thank you very much, Doctor. Right, so it's time to wind up our program on Rise and Shine today, and we hope you enjoyed it as we enjoyed presenting it to you, and we hope to see you same time, same place tomorrow as well. Till then, bye-bye from us.